try to use a feather-light touch. There's sort of divots here that you can use to grasp the probe there. And then I like to do a motion where you're following the skin, but just always make sure that the top of the probe is actually touching the skin. The very tip of the probe needs to have contact to the skin. I also want to emphasize that you won't want to collect too many points. I like to call that process painting. You don't want to paint the forehead. You don't want to paint the nose. You don't want too many points overlapping. You'll want to fill in space that's not collected, but you don't want to continuously go over points on this 3D model that have already been collected. That could also affect the registration accuracy as well. Another thing, you'll just want to always make sure that when you're tracing, to start tracing, you hold until you hear that chime. And then whenever you want to stop, you want to hold it again to the skin and then move it out of the field completely. And this will just kind of help the registration accuracy as well. You'll want to make sure that the registration probe stays within the EM field and contacting the patient's skin. If you move it out too soon, too fast, or just don't even realize that you're doing it, if it lifts up, that could ultimately affect the registration accuracy. The registration probe has divots on the side that easily form with your hands. You can grasp it like a pencil, like a pin, grasp it however you're comfortable. I think comfort goes a long way when registering a patient. I like to follow the flow of the skin as well, ensuring that the tip of the instrument is still touching. And moving at a perfect speed is also ideal. You want to make sure you're not moving too fast or too slow, but at a comfortable speed. And then once you stop, you can hold it to the skin, move it out of the field, and hopefully that helps the registration accuracy as well.